Thank you, Raphael. So thank you for this really diving in the zoom on the region. Now let's zoom out and consider Europe. So it's my pleasure now to host on the scene Madame Elsa Torchet and Alexandre Mirow from Deloitte, who will talk about the future of health in Europe. The stage is yours.
Merci, François. Bonjour, good morning, guten Morgen. We're super happy to be here. Thank you very much for the opportunity to talk about this very vast topic of the future of health. My name is Alexandre Mirow. I have the pleasure of leading our life sciences and healthcare practice at Deloitte, and we work, I would say, with the whole ecosystem of health in Switzerland, be it with manufacturers, be it with our beloved central government, with Smiths Medic setting the frame and the conditions to work, be it with health systems and care providers and all the patient organizations around this. I'm here today with Elsa, who leads much of our activity here in Romandie.
Good morning, everyone. I'm Elsa Torchet, Senior Manager in Alex team. I was working for Sophia Genetics that I see here. So for those who don't know yet, Sophia Genetics, we were providing a SaaS platform for genomics and multi-omics analysis. And I had the pleasure to rejoin Deloitte recently. And it's a pleasure to be with you today.
Excellent. So we were asked to talk a little bit about, about the future of health. This is a mega vast topic, of course, that we could talk for a super long time. And so we thought a little bit what would be helpful. And we wanted to add to this discussion on this very rich environment we have here in Vaud and broader in the country. And set a bit of a frame. Yeah? So what we'll talk about for the next 10 minutes is a quite broad, sweeping view of what the future of health could be. And that's purposeful because then afterwards our other speakers will fill that with specifics, fill that with detail, and we can all discuss over the rest of today how we bring this broad vision to life. So I'll open it up a little bit. And the first thing already, the future of health, it's a hard thing to predict. And we spent quite a lot of time on this at Deloitte thinking about where are we going. And one of the things that makes it difficult is that we kind of, when we think about the future, we tend to extrapolate. We think about what do we know today, what are some of the trends, and where may that lead us. And that actually works. But there's some research around this that it kind of works for a horizon of more or less 7 years, 7 to 8 years, and then it starts breaking down because then the change that we may have is so big and so complex that we struggle to really imagine what the future would look like. So if we think about a future of health in 15, 20 years, kind of in the 2040, 2045 time frame, then a lot of things could happen. And so what we rather than try and really take today and project, we think about some of the things that we're pretty sure about, some of these meta trends, and kind of think about if those are stable, that continue the way they are over the next 20 years, then what is a vision of how those things could connect of the future? And we'll talk about that a little bit. And some of these core underlying meta trends, I think, are pretty clear. The data and platform topic is something that we'll discuss a lot today. We all see this. We have so many wearables that are giving us health data that even Switzerland is working on putting these data together, right, across the canton and the health system and building an overall interconnected platform with DigiSanté and other initiatives. The same is happening at the hospital levels. And that is really necessary because the potential is really great on this data platform. And my understanding is that about 30% of the world's data is on health. But I also understand that, I was looking this morning, that about 95, 97% of this data is not used. And we see all this. It's not used to improve patient outcomes. And we collect data, the app tells us, ooh, your movement has been like this, your sleep has been like this, and that's kind of interesting, but it doesn't really feed into improving our health. It doesn't feed to the GPs, it doesn't feed to the hospital systems making decisions. So there's a lot of potential there, and that's driving two other meta trends that also we'll talk about more. One is that through that we see a pretty stable shift to more of a personal health, a more prevention mindset. So if it's not just the doctor every 4 or 5 months telling us, uh-oh, you better move more, do more of this, do less of that, but we constantly get informed about our health and start seeing early signals, that will automatically and is driving us towards more of a preventative and well-being mindset. And the same, these technologies are also used much in the care setting. And it says, speaking to one of the CEOs of the large Swiss healthcare systems who was saying that it's quite spectacular when we do something like book a flight and travel somewhere. It's a very complicated process, a lot of volatility, many things can happen, storms. But we know at all times where we stand, what will happen. We get informed by our devices. We can book an Uber when we get there, lots of things. Huh? When we enter a hospital, we know nothing. Right? We are Jon Snow. We stand there. We don't know who will see us, how long they will take, why they're seeing us, what is happening with the interpretation. So and there's a lot of that is helping generate more transparency and more connected care. So those are big trends, and I'll take a bit of a leap now and talk about 2040, about a future that we could see if these things continue. If you go to the next page, and it's not a given thing. So many other futures are possible. It could take longer. We could get sidetracked. We could have this just for part of the population, not for all of it. There's a lot of health equity challenges, but we want to just paint a future that is really possible. And for us, this really starts 2040 with that. We believe that then the approach we will have to patients and consumers will be much more personalized. It's a relatively evident start. If we right now we have all this data, you can really imagine that we ourselves form a more informed view of where we are, and that the healthcare system can engage with us in a much more personalized way. If this is the case, you can imagine other things. If we have a more personalized dialogue, then that, as I was saying before, likely will lead to a more preventative mindset. And we are starting to have the technologies to also act on that, of course. Right? We start to know and have long-term data about what actions lead to better outcomes. Those are often quite classic: sleep more, move more, eat healthier. But we can build in more nudges to get to that. We also think that then we will finally be able to make the most of early detection. I mean, today we can detect many things. The problem is sometimes we cannot do anything. But we think that over the next 10, 15 years, we'll be able to have more personalized interventions, and those two things together are really helpful to improve our health outcomes. Because then we can actually say, we may be going in the direction of a cognitive decline or having a certain risk of a certain cancer, but if we then have personalized treatments, cell and gene therapies, right now fascinating developments on the personalized vaccine mRNA front, then we can act on some of these things we may know, if we get sick. And all of that should lead to sustained well-being, and not just be, okay, we will avoid sickness, but we can prevent that sickness and we can treat if we need to and get to a broader sense of health. It's not a given future. There's a lot we need to do, but we think it's really worth it. Now, also in Switzerland, we ran some of the numbers of what this would mean for us.
Absolutely. So, if we shift the focus, what would be the impact on healthcare spending? If we do nothing, as we were describing, if we just don't rely much more on innovation and technology, we know that by 2040, in Europe, the healthcare spending will be more than 3,500 billion euros, mainly focused on treating sickness and delaying symptoms, not on prevention. On the contrary, if we decide to shift more and invest even more in innovation and technology, we can significantly reduce the cost. So in Europe, it means from 3,500 billion euros to 2,900 billion euros by 2040. So this is quite significant. In Switzerland, what does this mean? So if we do nothing again, in Switzerland, we estimate the spend around 150 billion versus 127 billion in 2040. The impact on that is that you are really shifting treating sickness, delaying symptom costs to investment in promoting health and restoring health. And these shifts actually enables government, health insurance, social insurance to shift from, again, treating things and instead of that, having like really healthy people in your countries. But concretely, what does this mean? As mentioned by Alex earlier, we have identified 3 key pillars around data, platforms, well-being, and care enablement. And we recently derived predictions by 2030, and we have selected 6 of them to illustrate a bit more what concretely this means when we talk about future of health. So for data and platforms, we tend to see a convergence of AI technologies and human to accelerate R&D, but also interdependent innovations in science and technology. Concretely, what does this mean? It's like you will use more and more Gen AI, you will use gene editing, you will also use in silico development to boost your drug development. And the impact is huge. It's from 30 to 40% of success rate right now, you can shift to 80 to 90%. We were also mentioning that, but you probably all have an Oura Ring today or an Apple Watch. You are becoming the consumer, the CEO of your health. What does this mean? It's like you probably have more data on a day-to-day basis than your own GP, than your own doctor. And so you are now empowered to use this data to really manage your health and your well-being as you want to do. And this trend is key because this is also impacting the consumer health market. This market is more and more dynamic, more and more customer-centric, and we'll see plenty of services, apps around that. So we are really shifting from, patients being treated to patients and consumer becoming the CEO of their own health. And last point is about care enablement. So in our trends, 2030, we also see the convergence between health, wealth, and longevity. Concretely, what does this mean? Again, it's like we know that government, payers, health, social insurance will work more and more together to build sustainable healthcare systems. And it means that they will invest more and more in preventive and restorative health. Finally, of course, sustainable healthcare systems. We know that without investing in sustainability measures for our own healthcare system, we won't be able neither to ensure a sustainable environment. So combining these 3 pillars that we have presented, we truly believe that the shift to empowering patients and customers, as well as fostering the collaboration between players, and we are all representing these players today, we truly believe that the future of health and trust our health will lie into these 3 pillars. So thank you, everyone. And last but not least, if you are interested in our Future of Trends 2030 predictions, we invite you to read the report that you have here.